My name is Peter Forster, and I'm a clinical professor of psychiatry at the University of California, San Francisco, and I'm going to be talking about the fastest treatment for depression. And I'm not going to be talking about medications. I'm going to be talking about 7 synergistic, they work together, steps that improve depression within days. The more you do, the better the results. We won't talk much about the science behind these, but each of them has clinical research and trials to show that they're effective. I want to begin with morning light. Morning light means 45 minutes of bright light before 9 a.m. And bright light can be therapy light or outdoor sunlight. The thing is that morning light uniquely synchronizes circadian or body rhythms. And that in turn means that during the day you have more energy and are more alert, and at night you sleep better. This is probably, of the 7, the one that works the fastest. The fastest thing for many people that they can do to improve their mood, and often works within 2 to 3 days. The second one is physical activity, and this means 30 minutes of physical activity that raises your heart rate. So a brisk walk is a perfect example. Intensity is not as important as regularity. And here I want to give you a tip, because there's 7 of these things. You might be feeling a bit overwhelmed, but you can combine them. For instance, if you go outdoors in a beautiful area in the morning for a brisk walk, you're getting light, activity, and pleasure all in one. Now here I'm going to mention a little bit about the science. It was a large British study that found that the intensity of physical activity was not what was important. The key was regular activity, doing something every day. And if you had regular aerobic physical activity, your rate of depression was half what it was if you didn't. Now, social interaction is a little bit more complicated, as you might imagine. In this area, we're going to be talking about 3 things under social interaction. The first one, pretty simple, morning social contact, daily and routine social contact. So nothing meaningful or big. Sometimes we call this cafe therapy, because what happens in Europe where people get together, say hello, greet each other, it's a perfect example of morning social contact. The second one is meaningful conversations, and what we're asking you to consider is twice a week at least, having a conversation in which you can talk honestly about things, including your feelings. And the final one may be something that takes a little while to develop. People you can count on, having people that you can count on when you need help, when you need support, and more than one person so that people don't get burned out. Then I want to talk about mastery and meaning. Again, there are 2 components of this. Mastery is the regular experience of doing things well, and noticing is usually the key. And the second is meaning, which is the feeling that your life has value and meaning, which can be related to mastery. Believe it or not, we're pretty sure that every day you do things well. We've gone through this conversation with many, many people and have never found anyone who didn't do anything well. However, you may not notice. For example, if you thought, I don't do anything well, then we're pretty sure that you're rating as unimportant all of the things that you are doing well, so you're not paying attention to them. So that's the key. With regard to meaning, it's important here to focus on what are your values? What do you think is important? How should we lead our lives? For what purpose? And then making your decisions and proceeding through life based on your values. This is a very powerful mood booster. Mindfulness. Mindfulness means 15 to 20 minutes per day of practice of mindfulness. And we really strongly encourage people to consider purchasing an audio cue. For instance, an MP3 that you could get from Amazon.com, or looking in iTunes under mindfulness. What is mindfulness? Mindfulness means paying attention in a particular way, on purpose, in the present moment, and non-judgmentally. And that's the definition from Jon Kabat-Zinn, who, by the way, has made a number of these MP3s, including The World of Relaxation. Proactivity. Proactivity means having an idea of what you want in life, not necessarily detailed or big vision, but just in general, what do you want? And then taking small steps every day to get there. And it's the small steps every day that's the key. Proactivity then contrasts with reactivity. And often in depression, we end up more stuck in a reactive mode. Proactivity is anticipatory, looking toward the future, and it's intentional, planned and considered. This is what I want. This is how I'm going to get there. Reactivity means reacting to the moment with little thought or often relying on automatic thoughts. And these are the negative, quick thoughts that may come up, or the fears or anxieties that get triggered by events. Let's turn to pleasure. Sometimes the hardest thing, especially if one's depressed. And here we're talking about doing one thing that is enjoyable. And it should be healthy, so TV usually doesn't count. Now we know that when you get depressed, it may be that nothing seems enjoyable, and in that case, you get full credit for doing things that in the past would have seemed enjoyable. Now, healthy, in this case, means at least not making you ill. So, for instance, drinking or using drugs, watching television, smoking, or eating unhealthy meals wouldn't qualify, but most everything else would. Feel free to combine these. So, in summary, we've talked about 7 things: light activity, social interaction, mindfulness, pleasure, proactivity, and mastery. You can start wherever you choose. You don't have to start with light or activity. Think about, what would be the easiest? And don't try all of them at once. Do the easy ones first and then add more, what we call bootstrapping. Maybe I can get up and get some light in the morning, but maybe that's all I can do. We'll do that, and then add the others as you have more energy and are feeling better. And, of course, the more you do, the better you'll feel. So I want to thank you. For more information, feel free to stop by our website at www.gatewaypsychiatric.com.